Services are commissioned by local authorities, our local councils, to provide a public health nursing service which enables families and children to have the best start in life. Due to the pandemic, we had to reduce the number of face-to-face contacts with parents, and this was a concern.
Two of the main things that parents can really struggle with is infant feeding, for one, and crying and learning how to cope with a crying baby and, the best way to manage that.
We had lots of parents with brand new babies who were coming home. They may have had less support than they anticipated having from their friends and family, and so we needed to make sure that as a health visiting service we were meeting some of those needs. We had 12 early years workers who very quickly came forward with real enthusiasm and flexibility, and we were able to retrain them to work in a completely different environment. We decided to look at the ICON programme, and that's a really good programme that talks to parents about the fact that it's normal for babies to cry as part of their way of communicating with us, and also an opportunity to talk about ways to settle and soothe their babies and to tune into their babies, and equally what to do when they feel that that crying hasn't stopped and they're beginning to feel overwhelmed.
A crying baby, especially if that baby's been crying for a long period of time, it can bring up feelings of kind of stress, frustration, even anger.
We approach it by just having it as a gentle conversation with the families. It's an amazing project, and I think everyone should be running the ICON project. It's amazing.
Having someone, running us through why do babies cry, how to cope with it, and not just the first few days. There's kind of a breakdown in the leaflet they gave you that goes through the 6-7 months and all the growth spurts they have that can cause huge cries. That was really, really useful. During a pandemic, really, they were my only point of really touch and face-to-face as well with the feeding team, so I just couldn't have done without them, I think.
Everybody is pulled together, we've been able to be flexible.
We were very much, what can we do for our families?
It would be really wonderful to see more nurses joining organisations such as Stockport Family, who are providing that support to families with young children, to increase the range of support that we could offer, when we recognise that supporting families means better outcomes for children.